Hi, in this video we're going to briefly explore feeding and swallowing disorders. Feeding and swallowing is an area of study that is actually part of obtaining a speech language pathology degree. So when we think about feeding, we may think of perhaps young infants or infants who have trouble sucking from a bottle or taking milk from a breast. And with swallowing, maybe issues with keeping food down. Now, in younger children and infants, these are common occurrences, but if they happen consistently and regularly, well, we might want to see if what we're seeing is a disorder or maybe a larger health issue. As we'll see later on, feeding and swallowing disorders aren't just limited to infants, but they can happen at any age. If this is your first time learning about Hear Center, we are a nonprofit speech and hearing clinic based in Pasadena, California. It's our mission to offer complete and affordable speech and hearing services to all walks of life. Our incredible staff offers services in speech therapy, audiology, hearing aids, and hearing protection. The webinar that you're watching right now is part of our free webinar program, and we're super grateful to our funders, donors, and the community at large who continue to make this program possible. So we are incredibly grateful for all of your support. So here's what we'll be talking about in this presentation. First, we'll cover the basics of feeding and swallowing, followed by a closer look at some of the symptoms and potential causes. Later, we'll discuss how these disorders are diagnosed, will not be followed by a Q&A. So usually during our live presentations, we do live Q&A sessions, but for the purposes of this video, obviously we cannot have that. So if any questions for you come up, feel free to send us an email at the email address below in the description box. So feeding and swallowing are necessary processes for our survival, right? So food is a source of energy, sustenance, and for many of us, happiness, right? So food is integral to our lives. Feeding and swallowing are the two important functions that allow us to stay alive and consume. While there are other ways of receiving nutrition, either through tubes or IVs, for most of us, we take food and drink through our mouths. If you have heard of feeding and swallowing disorders before, as I sort of alluded to in the beginning, you might have heard it in relation to young children and babies. That's because children have to learn how to eat and drink. They won't know how to do it automatically. And for some children, some issues can arise during this learning process. According to the CDC, approximately 120,000 newborn infants are discharged from short-stay hospitals with a diagnosis of feeding problems. But let's take a look at what feeding and swallowing is. When we look at it at terms of development, feeding contains a social aspect. If you think about it, feeding involves two people and a sort of existing relationship, one between the caregiver and the child. Feeding is an opportunity for communication, bonding, and other social experiences that set children up for future interactions with others. Feeding is one of the first social exchanges that babies undergo. But technically, feeding is any aspect of drinking or eating that leads to intake, sucking, chewing, or swallowing. What's swallowing? Well, swallowing is a complex process. Any food that we take is combined with saliva, liquids, and transported into our stomach, all the while making sure that nothing is getting into our airway. It takes us 50 muscles and 6 cranial nerves to swallow. Whew, that's a lot. And these work in harmony to create the 3 stages of swallowing. And before we get into the stages, I just wanted to quickly talk about the difference between a windpipe and the food pipe that are located in our throats. So this yellow tube that you see here in front is called our trachea, and this tube helps with breathing. This is where air enters after it's processed through our lungs, and then it also exits out the same way. The pink tube behind it is called the esophagus, and this is where food travels after we swallow. If you can see in the sort of top right here, it kind of looks a bit easy for food to accidentally land in our trachea, right? And that's where sometimes we cough and maybe choke. So looking more closely at the swallowing, some places may say there's 4, but for this video, we're just going to focus on 3. We begin taking food and liquid in our mouths and push it towards our throat in the oral phase. After that, we start to swallow. Food begins to be pushed down our throats. All the while, our windpipe is blocked off so that food and water don't accidentally fall in. If it does fall in and kind of lands in our trachea, well, that's when we know we have the sort of choking or coughing in order to dislodge it. In the esophageal phase, it's time for the food to get on the highway toward our stomachs. Any food or drink passes through here and makes its way towards the stomach. So for adults, all of these phases, it's learned, it's automatic, and we don't really need to think about it. Let's see, as I mentioned earlier, babies need to learn how to be fed and swallow what they consume. It begins when they learn how to drink from a bottle, from their mother's breast, and eventually they move on to soft textures such as purees. When babies are really young and in the beginning of feeding, it's normal to run into some issues with drinking and feeding. But if infants and young children continue to experience these issues often, well, parents and caregivers can ask the question, so is my child a picky eater or is it something else? There are certain issues that may arise with feeding and swallowing in infants, children, and even adults. General feeding issues are more common with young children. However, according to ASHA, eating disorders involve problems that cover a wide range of eating activities that may or may not include swallowing. So, for example, avoiding or restricting food intake, which is known as ARFID, ARFID, displaying inappropriate mealtime behaviors for someone's age, failing to self-feed themselves for their age, and failing to use appropriate food utensils for their age are all examples of what a feeding disorder or issue could look like. When we look at kids, it's expected that they may display some picky eating habits. They may eat a limited amount of food, but they're kind of comfortable overall eating foods across the entire food group or food chain. Is that the right word? Food pyramid. So they're comfortable eating grains, vegetables, fruits, and so on. A child with an eating or a feeding disorder or swallowing disorder may also appear as a picky eater, but they may eat even fewer foods than a typical child. They may also avoid entire food groups and certain textures. Here are some more specific signs that could show a feeding disorder in your child. So a child with a feeding disorder may have a hard time accepting and swallowing certain food textures. They may refuse to eat certain solids or liquids and maybe even have oral motor problems. They may also have some behavioral issues that appear at meal times, such as throwing tantrums, and they may avoid certain food groups entirely. One of the more obvious signs is frequent choking, gagging, or vomiting during mealtime. By any chance, have you noticed these signs in your child or a sign you know? Okay, so what about swallowing disorders? Well, the definition of a swallowing disorder is more straightforward. It is difficulty swallowing. Swallowing disorders are also known as dysphagia and can affect any of the three stages that we covered earlier. About 25 to 45% of children experience feeding and swallowing issues, according to children's.com. Adults experience some swallowing issues too, but maybe more inconsistently and in everyday life. We've all had food get stuck in our throat or had something hard to swallow. We've also had drinks go down the wrong way, causing us to cough and choke. Remember when that happens, whether it's food or drink, we're having things enter our windpipe, not our food pipe. And like I said, it's not uncommon for this to happen from time to time, especially if we're eating or drinking distractedly or if someone scares us out of nowhere. The problem is when this happens very frequently. When it comes to swallowing disorders, here are some other signs and symptoms. So someone may frequently cough during meals or have a hard time breathing. They may frequently have food stuck in their mouth or have a sort of wet quality sound to their voice. They may also eat very slowly because extra effort is needed to chew or drink, and they may even leak liquids from their mouth. During the live Q&A, we had someone ask us about laryngomalacia. And we didn't include this in our presentation, but after we did some research, we figured why not include it here for the recording. So, laryngomalacia refers to noisy breathing, and it's typically associated with infants. Stridor is referred to squeaky and noisy breathing that a baby may produce. It's noticeable when the baby is lying down and maybe when they have a cold. According to articles on this topic, this condition worsens before it gets better, but after 3 to 6 months, there should be some improvement. And in most kids, this condition goes away over time completely. The cause of it is unclear, but it may have to do with how the voice box was developed before the baby was born. In this image that I pulled from the website, I wanted to just quickly show you what laryngomalacia looks like graphically. So here with a non-soft larynx, the epiglottis stays open and air is able to flow freely through the nose and down into the trachea. With laryngomalacia, it is said that the larynx or the voice box is softer and the epiglottis actually falls back, so creating sort of an interference with the airflow. So as you can see here, the airflow is interrupted by the epiglottis, creating a sort of interrupted and inconsistent airflow, causing the squeaky, noisy breathing sounds. Although it is mostly tied to sort of loud breathing, it may also cause issues with feeding and swallowing. So if that is the case, here are some recommendations that we saw online. First of all, it's always important to follow the pediatrician or healthcare service provider's instructions, but what someone can do is to keep the child upright during feeding and at least 30 minutes after feeding. You want to burp gently and often as the child is being fed, and be wary of any juices or foods that may upset the child's stomach. You may need to speak with their health provider to figure out the correct diet for your child in order to minimize reflux or in order to find the best feeding strategies. So how can we detect these issues in infants and our youngest children? Well, you're going to notice a lot of trouble around feeding time. So more spit up and coughing than normal, avoidance of eating, it may be around certain textures, and low weight are noticeable signs. Other signs may include an arched back, excessive crying, or tantrums. So those were the symptoms for feeding. These are the symptoms for feeding and swallowing. And For children of 3 years and older, well, the symptoms, as you can see here, are pretty similar as well. Parents who notice some of these symptoms, they may intuitively guess that something was wrong and, have it checked out. But for those who maybe haven't yet, if symptoms and issues with feeding and swallowing go undiagnosed, it could lead to aspiration problems. If bits of food get stuck in our lungs, those food particles can form bacteria and germs. That could lead to something called aspiration pneumonia, which is an infection. And we could run into some nutrition issues as well, because when children aren't getting enough food or a balanced diet, they may have low weight or they may be unable to gain weight. We may also run into dehydration just due to low fluid intake. Feeding and swallowing disorders may stem from a range of things, such as nervous system disorders. If we remember that there are several muscles and cranial nerves involved in swallowing, well, we could see how a sort of malfunction in any of those areas could lead to a possible swallowing issue. GERD or stomach problems, or the reflex problems, cleft lip or palate, breathing problems, vocal cord paralysis, or other vocal cord issues such as the laryngomalacia, or premature and low birth weight could all be possible causes of feeding and swallowing issues. The existence of or the presence of any of these issues here does not necessarily mean a feeding and swallowing issue is guaranteed, just that they have been linked to feeding and swallowing disorders. So what are the steps to diagnosing feeding and swallowing disorders, and what are some treatments that professionals may suggest? Before looking at any sort of treatments or solutions, you first want to visit your child's pediatrician or healthcare provider and have them assessed. They can do an initial observation to identify any problems, and they can check if your child's current weight is currently developmentally on track with other children their age. At Here Center, while we do not offer any diagnostic or treatments for swallowing issues and for feeding, if there is a possible indication that those issues are present in a child, we would recommend a referral for an occupational therapist. However, it is always important to follow the recommendation of your child's doctor first. So if it is severe enough, if the issues are severe enough, or they may warrant an appointment with an SLP who specializes in those fields. They may also recommend, as I said, to an occupational therapist, a registered dietitian, or even a lactation consultant. Here's just a quick GIF of a possible test that they may use. The barium swallow test involves an SLP, a radiologist, and a radiologist technician to use x-rays to see how food and liquid is swallowed. So in this GIF here, the individual drank liquid mixed with something called barium, which is a white chalky substance mixed into food and liquid so that it can be visible on x-rays. So this is great because in real time, SLPs can assess the swallow and identify, okay, in what areas is the swallow being interrupted, or where does the issue appear? So this is one sort of test that an SLP may use to identify a swallowing disorder. The SLP will also look at some of these other areas as well in order to assess the feeding and swallowing abilities of your child. And treatment and counseling will depend on the case, but here are some things that an SLP may suggest to help with a diagnosed feeding issue. Medical treatments such as medicines for reflux, feeding therapy where children are taught better eating skills, position changes. So As we saw with laryngomalacia, keeping your child upright could help with feeding and swallowing. So perhaps an adjustment with feeding could be something that helps a child with those issues. They may also experiment with different diets and foods with different textures, especially if a child is particularly aversive to one. Solutions to help swallowing may include strengthening the muscles, such as tug movement and the muscles involved in chewing. Similar to feeding, they may look at adjusting head positions or seating adjustments. They may help a child be better trained in drinking from a bottle or a cup. And they may look at behavioral changes, especially if the child tends to be particularly fussy or moving a lot during the feeding process. Okay, so that was our very quick 101 video on feeding and swallowing. It was very basic, just because it is sort of a broad topic. But if you had a specific question about feeding and swallowing, you can send us an email below or give us a holler at our phone number to our clinic. So until then, we hope you have a great rest of your day, and thank you for watching our Hear Center presentation.